Do not pop a Stye. Do not squeeze it, even if it looks like a pimple and all you want to do is pop it. Just don't. Today we're breaking down Styes, what they are, why they happen, and what you can do about them. You don't want to miss it. Let's go. Hi everyone, welcome back to the channel. If you're new here, I'm Dr. C, a double board certified optometrist and the owner of Eye Drop Shop, a place I created simply so that the best eye-safe products can exist all in one spot. But I do want to be transparent. The products I'll suggest and link to are based on my own preferences, both in clinic and personally. Nothing in this video is sponsored. I'm not being paid to promote anything specific, whether it be a brand or a product, and I just wanted to make that clear right off the bat. If you care about your eyes, please like, subscribe, and ring the bell so that you don't miss any of our future episodes. Now, with that out of the way, today we're talking about something so common and frankly, so annoying, and this is Styes. If you're watching this because you currently have one, take a deep breath. I know they can be uncomfortable and sometimes a little bit stressful, but they're solutions and you are absolutely not alone. Let's walk through what a Stye really is, why it happens, and how to treat it safely at home, what we can do in office, and when it's the time to see your doctor. A Stye, or what we call a hordeolum, is basically a clogged, inflamed oil gland in your eyelid. Your eyelids have these tiny little glands inside them that release oil onto the surface. When one gets blocked, bacteria can build up behind it, and that's when a tender bump will form. Most people get what's called external Styes, so that's when you see that typical little white bump on the outside of the eyelid. But there's also something called internal Styes. Those are a little deeper and more painful because they really sit on the eyeball. In some cases, if a Stye settles, it can leave behind a firm bump, and that's what's called a chalazion. That's a whole separate process, and I'll make a full episode on chalazia because they deserve their own deep dive. Here's where it gets interesting. Now, there are many reasons these little glands can get blocked. Your natural oils might be thick or sticky. You might have dry eye or meibomian gland dysfunction. Or maybe there's bacteria or little mites along the lash line. Old makeup, rosacea, stress, these can all contribute. But the biggest reason that people don't realize is rubbing your eyes or touching them during the day. We do this way more than we think, and this is how bacteria spreads. So if you don't change anything else after this video today, stop touching your face during the day. With that being said, there are always solutions and you can definitely get this under control. Most Styes respond beautifully to simple, consistent at-home care, but only if you do it the right way. Let's go step by step. Warm compresses are your first line of defense. They help melt the thickened oils inside the little glands so that the Stye can drain naturally. Now, something important. Sometimes the eyelid could look a little worse before it gets better.
It'll get worse before it gets better.
And that's completely normal. When you apply the heat, you dilate all those tiny blood vessels in the lid so you can temporarily see more redness. And if you have rosacea, you might get even a small flare-up because your skin is more reactive. So ease in gently. Heat can be incredibly powerful when used properly. Using a proper doctor-approved microwavable or even rechargeable heat mask can make a huge difference. This is an example of a microwavable heat mask. It's called the Brooder, and why I like it is because you could heat it in the microwave, it gets to the right temperature, and it stays consistently hot for the 10 minutes you need. Now, it's relatively inexpensive and a great option if you're just getting started. There's also some heat masks that are rechargeable, so you could charge it and leave it beside your bed. These are very convenient, although the price point is a little bit higher. I'll link a bunch of examples below so you guys could check it out and see which one is more convenient for you. Here's how to do a heat mask properly. Heat the mask according to the package instructions, then place it over your closed eyes for 10 minutes. You should feel a gentle warmth, never burning. You could test it on your hand just to make sure. Once it's done, you really want to do blinking exercises and let the oils drain naturally. If you want a detailed explanation of how to do blinking exercises, you could check out this video. The key is to catch your Stye early and do these heat masks as often as you can during the day. Next is lid hygiene. Once things start opening up, keeping the eyelid area clean is really important. Not harsh scrubbing, but just gentle cleansing. Here are a few options. Foam cleansers, which are light and easy to massage along the lash line and super good for daily routines. Another one are these pre-soaked wipes. These ones are called Clean, and I love them because they come in individual little sterile packages and they're really easy to keep on the go. They're great because they have antimicrobial properties, so these are the ones that I carry around and clean my own eyes with whenever is necessary. And I truly love the fact that they're very easy to just put in your purse, and if there's anything, you could use them right away. With these ones, you would actually just put it on the tip of your finger like this. And when you're trying to clean a stye that's on the top lid, you really want to go in a downwards motion to go away from the lash margin. And similarly, if you're trying to help a stye that's on the bottom lid, you look up and you really want to go like this, side to side, and rub away any kind of bacteria or debris that could be on that lid margin. Another amazing option is something called hypochlorous acid. So different than the foam and the prepackaged wipe, this one is actually a spray. This one's called BioCell. And once again, this is one that I personally carry around. It's a natural disinfectant, so it's safe enough to use on really small young kids, but it's very powerful at removing any kind of bacteria and stuff like that. And the way you use it is great. So remember how I was telling you not to touch your face during the day? Stop touching your face during the day. This is a great option for that because the way to use it is you just spray it all over your face and you let it dry. There's nothing else to do. I'm gonna show you exactly what this is and I'm doing it for you, although I do have a big reflex. So normally, hold on. Oh, no, actually this feels fantastic. That's how you do it. And then you just leave it there and it will dry. Sometimes but that's just me. So this is a great alternative option that I also keep equally in my purse for all kinds of things. Of course, it's great for styes, but it's also great for disinfecting your hands, disinfecting surfaces. It is the secret weapon that we all should have on us at all times. Next is something a lot of people overlook, which is omega-3 supplementation. I talk about it all the time with respect to dry eye management, but omega-3s really act as a natural anti-inflammatory. So they're very good for the health of your eyes and those little eyelid glands we've been talking about. This one specifically is called PRN, and I like to recommend this one to my patients because it has the most clinical studies attributed to it. And really, it has the right dose, ratio, and form to actually help the little glands in your eyelids for dry eye. And a fun fact, so this has a ratio of 3:1 of EPA to DHA. Now, if you were to flip that ratio and make it 3 DHA to 1 EPA, you're actually hitting the retina, which is the back of the eye. So just that little modification in one little gel will affect what part of the eye is affected. And that's why for me, my patients are mostly on PRN and I feel very comfortable. I actually take this one myself. When your body has enough omega-3s, the oil your glands produce tend to be smoother and healthier. And when it doesn't, you're likely to get thick, toothpaste-like oil, the exact type of oil that will clog the glands and eventually lead to styes. Now for some rapid-fire don'ts. Don't pop the stye. Do not squeeze it. Don't use leftover antibiotics. Don't use makeup until it's settled, because all these things can slow healing and introduce more bacteria, which can make it worse. If your stye isn't improving, keeps coming back, or is looking funky, that's when you gotta go see your eye doctor. That's why your eye doctor is here, to help you feel better quickly and to do so safely. When a patient comes in with a stye, there's a few options that we could do. Sometimes, depending on the severity, we could put a topical antibiotic or anti-inflammatory. Or if it's worse, we could actually give an oral antibiotic to make sure that the infection goes down quickly and doesn't spread. Other options in clinic are IPL, also known as intense pulse light, microblepharoexfoliation, red light therapy, radiofrequency. We have so many in-office treatments that can help. And if you would like me to do a deeper dive on this, leave a comment below and we'll do it on one of our future episodes. Here's when you should reach out for help and see your eye doctor. Anytime that you have redness, pain, change of vision, you should call your eye doctor. If you have increased redness, significant pain, swelling that's spreading beyond the lid, changes in vision, or if things aren't improving. Styes can progress into things like preseptal cellulitis or actually orbital cellulitis if they're ignored. And again, I'm not telling you this to scare you. I'm telling you because you deserve to feel safe and supported, and that's what your eye doctor is here for. So as I always say, when in doubt, go get it checked out. If you're dealing with a stye right now, as you're watching this video, please know these things happen and there are solutions. Gentle, warming, blinking exercises, and going to see your doctor for extra treatment is all available to you, and this will get under control. If these tips helped you, please like, subscribe, and ring the bell so that you don't miss any of our future episodes. Make sure to take care of your eyes, and I'll see you in the next one.